Hello, all, and welcome to this new episode of Global Voices on Heart Rhythm TV. I'm your host, Juan Carlos Zerpa. And we're going to talk today about the cardioneuroablation for reflex syncope, efficacy and effects on autonomic cardiac regulation, a prospective study, randomized trial, that is the first randomized controlled trial approaching cardioneuroablation, the Roman 1 trial. It was published in September in 2022. And to tell us everything about it, we are joined by no other than the author, Roman Piotrowski, the author of the Roman trial. Dr. Roman, welcome to Heart Rhythm TV.
Hello, good evening, good afternoon. It's pleasure to be here, and it's pleasure to be part of Heart Rhythm TV. And thank you, Juan, for your kind invitation. Today I'm going to talk about our recent study, which was recently published, concerning cardioneuroablation for reflex syncope. Firstly, a few words of introduction, because we know that cardioneuroablation is relatively new and promising method and option for the treatment of patients with vasovagal syncope. I said especially new because it's not new method. It's relatively new method because Pachon introduced cardioneuroablation in 2005, and since then the data showing effectiveness of cardioneuroablation are still growing, but there is still lack some randomized studies which compares cardioneuroablation with another studies, and due to the lack of this data, the cardioneuroablation does not have any class of recommendation in current American and European guidelines. So in our small center, we decided to conduct and design a randomized study which compares cardioneuroablation with a control group with optimal non-pharmacologic therapy according to the current guidelines. So the inclusion criteria to our study was simple and was similar to previous studies which was published, and it was at least one documented spontaneous vasovagal syncope during 1 year preceding cardioneuroablation. And in case of lack of documentation, lack of ECG documentation of vasovagal syncope, the patient were performed head-up tilt test, and if at lasting 3-second asystole and bradycardia below 40 beats per minute occurs, the patient will enter to study. And of course, all patients had positive atropine test, which means that after atropine injection, sinus rhythm increases over 25% than baseline values. So after they entered the patient to our study, the patients were randomized to cardioneuroablation or to control group. So each group consists of 24 patients. Of course, the patient who were qualified randomized to cardioneuroablation group have cardioneuroablation procedure, and the patient who entered to control group receive optimal non-pharmacologic therapy, including lifestyle modification. They received detailed instruction how to avoiding situation triggering syncope, proper salt intake and proper hydration, and they were instructed how to do counter pressure maneuvers. As you can see on this slide, after cardioneuroablation and after instructed the patient, the follow-up of our study lasted 2 years, and the primary endpoint was time to syncope recurrence, and the secondary endpoints were quality of life, assessment quality of life, and assessment how to cardioneuroablation affects on sinus rhythm and heart rate variability. And now I would like to go into the detail of cardioneuroablation details. because when we conduct our study, we did not have extracardiac vagal stimulation. So our approach was anatomical approach combined with fragmented electrogram ablation. Our procedures were performed under mild sedation using fentanyl and midazolam, and we mainly focused on septal ganglionated plexi, right anterior GP and posterior medial left GP, as we can see on the left side of the screen. And each RF application were assessed using ablation index value. And of course, in all procedures, we used intracardiac echocardiography because we think that intracardiac echocardiography is really helpful, especially for transeptal puncture and positioning the ablation catheter, especially during posterior medial left ganglionated plexi. And the acute endpoint during cardioneuroablation was acceleration of sinus rate over 25% than basal values, and of course eliminated of fragmented EGM in ablated area. And during the procedure, we also assessed electrophysiological parameters. And at the end of the procedure, atropine was administered, and the increased sinus rhythm less than 10% was taken, and successful vagal denervation. So as you can see and you can hear, we did not use extracardiac vagal stimulation. What is the one limitation in our study? So that was the problem which we arise later. And as I mentioned earlier, follow-up lasted 2 years. And next, we can go into the results. So as you can see here, you have a table which showing demographic and clinical characteristics of both groups, cardioneuroablation and control group, and there is no significant differences between both groups. As you can see, our patient were really symptomatic because mean assistolic duration in cardioneuroablation and control group was 60 to 19 seconds. So this is really symptomatic syncopes. And next, this is the first primary endpoint. This is the time to recurrence to first syncope, and we can see here that patient with cardioneuroablation group had only 2 syncopal recurrence during 2 years follow-up, while the patient in the control group, the syncope recurrence occurred in 13 patients, so it's 54%. And the next interesting result is quality of life, because there is no data concerning it, and we can see that cardioneuroablation improves quality of life. We used a dedicated questionnaire designed by Dr. Sheldon, and in this questionnaire, the higher scores means the poorer the quality of life, and the lower scores means the better quality of life. And we can see in the blue color is cardioneuroablation group, that cardioneuroablation extremely improved quality of life in patient, whereas in the patient only from control group, the quality of life was stable. And the next results, there is, of course, secondary endpoints next, the mean sinus rhythm and the parameter of heart rate variability show that cardioneuroablation increase mean sinus rhythm, and show that cardioneuroablation affect on heart rate variability toward into parasympathetic withdrawal. So there is our short presentation concerning cardioneuroablation, and this is the first randomized study comparing cardioneuroablation with non-pharmacological optimal treatment in patient with vasovagal syncope. So my comments one is that change the guidelines? I don't know, because we still need more data. And I know that in the Belgium, the sham controlled study is ongoing, designed by Dr. De Bruin. So we are waiting for the results. So maybe after this study, the guidelines regarding syncope will change, I hope.
This is really important facts that you are presenting. There was a great presentation, a great resume of your work. And there are some details that I want to talk and we can explore. All the patients were young patients, right? Very, very symptomatic patients with repetitive syncope. And those who have refractory, you try to distribute in a group for cardioneuroablation and a group with control with regular treatment and conventional treatment. That was liquid intake and sodium intake, right? There was some medication that you use for that.
So as you can see here, there is mainly non-pharmacologic treatment, but you can see in specific cases, the patient use midodrine or fludrocortisone, but it's small. Is in small majority of cases. So it's
okay. The most of the patients were without pharmacological treatment, and those patients that had pharmacological treatment were fludrocortisone and midodrine, right? And those patients, maybe you have some good effect. But we're talking about cardioinhibitory syncope, right? With asystole, with AV block. So these patients is harder to manage only with these kind of maneuvers. And this is why this is so important work, trying to compare what you can achieve with vagal denervation and what you can achieve with the regular treatment that we have already available. Excellent. Some of the patients has a pacemaker. When did the pacemaker was implanted? You got two patients in each group.
Yes, we have two patients, and this patient had pacemaker implanted over 10 years ago, but there was no another option to treatment, prolonged asystole in this patient. So since in our center, in our country, since 2016, cardioneuroablation was implemented in our center. So the new option was occurred. So
exactly, but it's
patient
also useful because you can use the pacemaker information to follow up, right?
Yeah,
That's something that we can have this information and to see if the patient goes good. Let's move on a little to the endpoints and how do you did the ablation? You told me that you were about anatomical guidance and electrograms guidance, searching for these fragmented electrograms, right? Can you show the lesson set that we see?
In our experience, because one of our teacher was Dan Wichterle from IKEM Prague, and he showed us perfectly method. It was anatomical approach, and in our EP laboratory, the cardioneuroablation little evolve, and we added fragmented electrogram ablation. So now there is still basically a method cardioneuroablation, but we we modified it using now extracardiac vagal stimulation. But in this study, with only anatomical approach combined with fragmented EGM ablation.
Exactly. And you can measure the heart rate increase, having the effect of the vagal denervation. Okay,
Uh,
excellent.
with-
But heart rate increase, we have seen that maybe is a weak predictor for sustained innervation, but it's what we have. And when you go for ablation and you can abolish you can provoke attenuation of the electrograms and cause this heart rate increase, you are performing and you are achieving the vagal innervation. Excellent. Excellent. And how this was a good follow-up also. You have patients with more than 12 months, patients to go over 24 months. And this is useful to see reinnervation signs and side effects. How did you control this? How did you control the reinnervation signs? And have you seen any side effects that concerns?
We control reinnervation only using Holter ECG because there is no another option. One of the limitations of our study is lack of implantable loop recorder, so we use only ECG. And yes, that's true. The reinnervation little occurred, but the syncope not occurred. So maybe just modification parasympathetic part of autonomic nervous system is enough. I don't know. We don't know, I think. We still collect the experience. We are waiting for the longer follow-up, I think. And the most common side effect, I think, is the inappropriate sinus tachycardia, which our patient it's 8%. So I think it could be a problem in the future.
Yeah, that's something that we have observed too. When you are comparing and of the heart rate variability, you can see that you have some reinnervation with almost at the first year, and after that you can see that the reinnervation stops and never gets back to the pre-cardioneuroablation level, right?
Yeah, I think.
And about side effects, yes, sinus tachycardia is something that concerns, but we have seen like it doesn't sustain. You can have recovery and imbalance in sympathetic and parasympathetic tone, and you can see the heart rate, the maximum heart rate, decrease a little bit, and some patients stop feeling, and some patients you need to do some rehab and exercise to recover this. Great. The other thing and the other detail that I see that was really marking and important was quality of life. You had a huge difference between groups. Why do you think this happens? Why do you think that the quality of life was so important, the changes in the cardioneuroablation group, and you didn't see it in the control group?
I think important question. It's a good point because I think sometimes cardioneuroablation may not prevent syncope occurrence, but just reduce number of syncope. And I think why cardioneuroablation works, because the patient do not afraid syncope recurrence. I think this is a special dedicated questionnaire created, as I mentioned earlier, by Dr. Sheldon, and there was a lot of specific question, and the patients really after cardioneuroablation observed decrease the signs of depression. They didn't fear to go into the people. So I think the quality of life could be the primary endpoint of all studies.
Yeah. What do you think about the heart rate variability? Because you decrease the heart rate variability. Maybe these have something to do with the better quality of life.
Yeah.
There's something that we have to study. Let me ask you a little bit more. And the follow-up, did you did any other tests? Did you repeat the tilt test? Did you do any atropine challenge after that?
We try, but COVID pandemic stopped
Oh, yeah.
that. So we don't have data about
But
that.
you have symptoms, and the patients didn't have recurrence of the syncope episodes. Even considering that it was a small population, this is the first of many stories answering doubts about all what we have, and now we improve the scientific strength with this RCT. This is good. You have objective endpoints as heart rate and syncope, but we have so many tools that we can use. The CVS is a good one, but we have to reproduce and make it available for everybody. So that's not a problem with this, but you have good result.
Yes,
I know for sure. Yeah, you can talk.
but I think our results should be reproduced in the larger studies, I think. And the sham procedure also is crucial, because lack of sham procedure is still arising by the expert.
Exactly. But I think it's the next step. You kick first, you did the first kick. So we're gonna try to go further with the work and do for more. Sham is gonna answer so many questions as it did with the pacemaker implantation, the pacemaker studies in syncope. And we're going to learn more and more about this hot topic in the future for sure. Roman, thank you very much for being with us and sharing some times in Global Voices.
Okay, thank you very much.
Congratulations for you and for all the team for this excellent work.
Okay, thank you.
Want to keep updated? Follow Heart Rhythm TV on social media and YouTube channel for the best EP content. Stay tuned, stay safe, and wish you all an amazing day. Thank you very much for watching.